In this video, I'm going to talk to you about this book published by the Harvard Business Review, To Better Mental Health at Work. And as a psychiatrist, it's pretty opening for me because typically as a psychiatrist, I'll just see patients that are struggling with something like depression, anxiety, ADD, something in their life, and I will treat them with their symptoms. And usually I'll treat with a combination of medications and therapy. But this book brought interesting perspectives about what the dynamics in the workplace would be like, what the situations for managers might be like, how it might affect other employees or colleagues in the workplace with someone suffering from a mental illness. And that part is a little bit eye-opening, and at the same time, there are some things that were recommended but weren't really by mental health professionals, so I could provide my 2 cents about that. Otherwise, this book does an interesting job about what people should do in different situations, whether they're suffering from anxiety or depression. It goes about the individual, how they should manage it, about the managers, how they should deal with employees that are going through that, or if an employee or someone is suffering from that, how they should approach this topic with their managers or colleagues, if at all. And there are some common themes throughout. So I basically thought it would be good to sort of summarize a little bit what each section talks about and present it in this video, and maybe hear from perspective of the viewers if this applies to you, or maybe for you guys to learn as well. And also I'll give my 2 cents from my experience as a trained clinical psychiatrist about what works, what doesn't work, if there's anything that's not really the best advice, etc. So first of all, with the introduction from this book, the person credits their suffering from mental illness as something that's actually helped them build a successful career. So basically, their mental illness helped them to develop greater empathy for other people, to be more aware of oneself, and to develop better skills with other people, which helped them in their workforce. This book goes on to cite that employees who talk to their managers about their mental health problems typically will be more productive. This was actually done by a study by the London School of Economics. Whereas people who did not talk about their mental health struggles, if they went through an episode of depression, needed to take an additional 4 days off in a year compared to someone who did open up about their mental illness. So there's an estimate of pre-pandemic data that the WHO or World Health Organization estimated that people suffering from anxiety and depression count for $1 trillion lost productivity in the global economy. That's a lot of money. The opening section of this book says that 80% of the people, whether they know it or not, will go through a diagnosable mental health condition. But almost 60% of people will never talk about it. But oftentimes, many of these symptoms or challenges that people go to, they can make it their strength. And I just want to take a moment to say that is a healthy way to deal with challenges and struggles in life, when you make it into something positive and constructive for yourself and society. So the first step is to really be reflective. If someone is suffering from mental illness, is this a new episode or is this a chronic episode? Was there something specific in life that could have triggered this, like unusual stress, health of a family member, maybe relationship stress? It's important to reflect on what someone is feeling. The authors acknowledge that asking for help or accommodation can be a little bit scary or make people nervous, but it can make a world of difference. Maybe just going in late on a Friday to see a therapist once a week can really help someone with their productivity and their mental health and emotional well-being. The authors recommend to kind of be aware of what the law is in someone's institution. For example, they cite that employers with 15 or more people in the United States, they're required by law to provide reasonable accommodations for people, such as allowing people time to go to their doctor's appointments or see their therapists. Also, it might take some discernment with how much to reveal to someone's manager. Is it important to tell them your whole diagnosis and exactly what you're going through? Or is it important to be something a little bit more vague, such as, I'm going through a difficult time right now, can I have Monday and Tuesday off? And maybe just keep it general about your life, but not specific details or treatments about what you're going through. Sometimes also when people are struggling through mental illness, it can be hard to think and plan and problem solve. So it's important to have a good network of people around you so you can talk with, that you can help problem solve, brainstorm ideas. Maybe it's a spouse, maybe it's a parent or friend or a therapist. And be sure to create time with that person to talk about these issues. Also, they recommend to be open with your manager or your HR department. And if you have generated ideas on what may be helpful or beneficial, ask them if that will be okay. From a clinical perspective, from a psychiatrist, it's okay to ask a psychiatrist for specific recommendations or accommodations. At the same time, I think it's important to go to people or your clinician with an open mind, because people who are too set in their ways or too structured in their ways, not open to other suggestions or opinions, it may be challenging for them to improve and get better. Especially when you're coming to someone with an expertise like a clinical therapist or psychiatrist, mental health provider. Be open to their recommendations and how they suggest. And the accommodations in particular, it might be better coming from the employer or the manager because they know the office environment and there's going to be a lot of dynamics in play in the office environment. For example, if you do have special accommodations, how is that going to affect the other team members? But if you ask your doctor or psychiatrist about special accommodations, they may just sign off of it just so you don't fight with them or argue with them, but they may not really understand all the implications that's going to happen in the workplace. Sometimes when people are struggling with mental health, they can feel easily overwhelmed or avoid tasks altogether. So one suggestion was to break things down into small tasks. And even if you are able to set a certain amount of time down in the day and complete a small task, that may help to propel forward to complete even more greater tasks. But if people are struggling with an anxiety or depression or ADD, and there's a big project or task to take care of, it might cause them to procrastinate or be scared or just avoid it altogether. So try breaking it down into small, manageable tasks to get the ball rolling. If someone is struggling with ADHD, maybe get the input of other people on the project to brainstorm ideas, how to break it down into small tasks. And someone suffering from bipolar disorder, it's going to be really important to have regular and consistent sleep. So maybe it might be important to address with your employer about not working the night shift or having regular sleep schedule or shift schedule so that sleep is not as compromised due to the work. In the United States, there's an Equal Employment Opportunity Commission's website where people can go to see what accommodations are reasonable based on their mental health condition. But different countries may use different terminology for the same thing. For example, the United States will use accommodations, whereas the UK will use reasonable adjustments. So when you have a mental health challenge or illness, you want to kind of be careful about having a good balance. Don't make things too difficult for you and avoid tasks altogether, but at the same time, don't make things too challenging and put too much on your plate. So you need that balance between the right amount of stress that can be motivating and encouraging and help you structure and get your day rolling, but not too much stress where you feel that you're overwhelmed or can't get stuff done, and not too little stress where you're too lazy or indifferent or just don't get yourself up to do things. Another interesting suggestion that this book suggested was to have a certain time where you are productive and get things done, because we tend to function habitually or on like autopilot, so to speak. And so if there's a certain amount of time a day where you get stuff done, then be sure to focus during that time to get things done. Maybe don't distract yourself with your phone or doing other things, but if it's like from 10 to 12, just focus from 10 to 12 on your responsibilities at the time. And this could be especially come in handy if someone is going through a clinical episode where their mental health is more worse or struggling. They at least will have that dedicated time where they know they're pretty productive and can get things done during that time. Also, it suggests that these moments of feeling productive can help with stress and prevent people from being unraveled or get into sort of a crisis mode where nothing is accomplished. Another thing the author suggests is to be really aware of yourself and have compassion on yourself. If maybe you do only deep work like Monday through Thursday, then leave that for the more complex and more deep work. And the other tasks, like admin tasks, you can reserve for like a Friday, so that there's some sort of consistency or schedule. You don't have to necessarily have all this deep, meaningful work 24/7. Also, one of the authors suggests it's okay to be unfocused at times. Let your mind wander, go for a walk, take a shower. Sometimes those are when we have the most brilliant or creative ideas. For example, if you're stuck on an assignment or project and you don't know how to get through it, maybe go for a walk or let your mind wander a bit. Don't get too hard on yourself because you can't get things done at the time. Also, you might need to cater the situation for your specific condition. For example, someone with depression, they may need to schedule more time during the day for activities that they enjoy, whether it's going for a walk, having a cup of coffee, and so forth. Or someone with social anxiety, if they just recover from, or they're just in a team meeting or gave a speech, maybe they need more time afterwards to recover and center themselves than someone who doesn't suffer from social anxiety. Depending on the work that someone does, the more breaks or rest they may need. For example, if someone's work is more innovative or more mentally challenging, they may need a little bit more time to let their mind wander or take a break to restore themselves. It's almost impossible to expect oneself to be firing at all cylinders at all times. This author who's suggesting this piece was also a clinical psychologist. Their suggestion was for managers to encourage their employees to let their mental health needs known, because part of the manager's role is to get the best and most out of their employees. And if someone is struggling through a mental health problem and isn't able to bring it up or have the reasonable accommodations, then it might make their work suffer as well as the work of those around them suffer.